I'm Wekwanya Ambrose, an ophthalmic clinic officer running GAF Eye Health Foundation here in Namsindwa. Yes, we have been doing a lot of services on ground, and specifically we are extending eye care services to the areas where they don't have eye care services. We have so far moved now a half a year. We are moving towards a year of operation, and we really find out that eye care is very a big need in our community, that is Namsindwa, and we have been able to register many cases. We have had over 5,000 patients who have been screened, and we have had over 200 surgeries done for those who need cataract surgeries, and we have been able to also treat those who have different alignments as far as refractive errors, those in schools, those we have met in our facility. So eye care is really very important, and most of our findings, we really find out that most people are having cataracts, which is age related, and because it is painless, many people sit in the communities without taking it a very serious thing to get out to go and seek for care. But through our interventions, we have been able to identify, and we have collaborated with different partners to see that we can have the cataract surgeries done for them. So we are really so grateful, but we call upon all the entire public that checking eyes is very mandatory. Don't wait for the eyes to stop seeing before you check. It is very important to check the eyes routinely, whether they are paining you or not, whether you're seeing clearly or not, because there are certain diseases. We really even found out patients who have glaucoma, or what we literally mean as eye pressure, which does not pain, but at certain point, these people end up losing sight. So checking eyes is mandatory to everyone, and don't wait for the eyes to stop seeing before you can come for eye care. Sometimes when it comes in the advanced stages, we are not able to recover the sight. But those that we meet as early as possible, yes, we do our best depending on what we find out, so that they can be able to have vision in their eyes. Different organizations, different people to come, and we extend the services to more places. Alignments or diseases which do not necessarily bring immediate blindness. For example, we have something that is on rampant, that is the digital vision syndrome, whereby because of the continued use of computers and gadgets every time, we really see that many people are developing this digital vision syndrome because of the use of gadgets. But the good news with it is that we have different interventions which ranges from behavioral treatment and also prevention. For example, we always recommend that an eye checkup is very important, because you can think it is a digital vision syndrome, yet it is another thing. So the first thing is all people to come up and have an eye checkup. Then we can be able to guide, like when you're using gadgets, there are certain things that we need to put in mind. For example, we have what we call a 20-20-20 rule. When you're using your computer, you need at least to use your computer for 20 minutes. Then after that, you look away for 20 seconds to a distance of more than 20 feet. And that is very important. If you're using a desktop, make sure that it is like 1 meter distance away from your face, and you sit upright. You really see that many people will not have this digital vision syndrome. So it is very important for all people. And to some stage, we need also to improve on our blinking rate. Many times when you're using gadgets, we are very keen at not making mistakes. So sometimes when you're in entertainment, you feel like you don't want to miss out a point. When you're watching, for example, you want to see when the goal is being scored and everything. So many times the blinking rate comes down. So what we encourage the public, or encourage people, is that blinking is part of eye physical exercise that we need to do. And when you do it for the continuous time, you see that the brain will also adjust, and it will always ensure that it keeps on blinking. So there are very many things, and also sometimes after our examination, we can find out whether we can give you spectacles to prevent or protect your eyes from the digital lights or not. Yes, after the eye examination. But we encourage the masses, we encourage people to come up and seek for eye care services, seek for eye checkups, because it is very important. You may misfire and you may think a different thing, yet you are having a different thing. So having an eye checkup is something that we can talk for the whole day, to see that many people can turn up and have the eye checkup so that we can treat all the diseases. Collaborated surgeries, where we have collaborated different partners, like we have said, over 200. But of course, cataract surgery, most of them, they cover 100% sight, as long as there is no any other underlying diseases like diabetes and so on. Yes, most of them recovered sight. Some of them it was in one eye, others in two eyes, and we have really shared with some of our stories on our YouTube channel. We how to recover, and now they are doing well. And we do not only collaborate on surgeries, but we also go down to where these patients stay, because sometimes after the cataract surgery, some patients may not be able to reach out to the facility. So we always come out to reach out where they stay, so that we can do the reviews even in the home-based eye care, where we reach back to where the patients come from, more so those who have completely or totally failed to come back for reviews, because there is need for monitoring. But the good news is that most of our patients have been recovering sight, almost 70 to almost 100%.